Hello, I'm Bernard Kemker,
And my name is Morgan Greene.
and we're the adult arthroplasty or the adult hip and knee replacement team at Carolina Regional Orthopedics. One of the common questions we get is, why are we a team? Well, one of the reasons we're a team is we will both evaluate you whenever you come in. Dr. Greene, she'll help me with the early evaluations. She'll also help me in trying to get you ready for a surgery. Whoever sees you first, whether it's her or I, we will work together to get you optimized and are ready before surgery. Once we think that we have you in a space where you're ready for surgery, you'll have a one-on-one consultation with myself before you ever proceed with any type of surgical procedure. I believe it is imperative for their patients to know their surgeon so they can develop the trust with their surgeon in case a complication unfortunately occurs. However, Morgan, or Dr. Greene, is very involved in the process. After you see me and we get you set up for surgery, we deem that it is safe for surgery. The biggest thing with any hip or knee replacement is a post-operative and an intraoperative plan. And Dr. Greene really helps take care of that. Can you talk about your preoperative plan?
During your pre-op appointment, I go through all of your medications, your medical history. If you have any medical clearances that are needed, I make sure that they have been received by us and read, and any medications that need to be stopped is noted in that note. I also go through your lab work to see if there's anything that needs to be updated prior to your surgery, and talk about the process between my pre-op appointment and your surgery date, along with how long you might stay in the hospital and what the hospital stay will look like.
She will also undergo a process with helping train the person that's going to help take care of you after surgery, or we both will. It is good that you and your partner, or helper, or cousin, whoever is helping you after surgery, knows the plan of the not only surgery but the post-op rehabilitation. One of the other questions I get is, will the doctor be in for the surgery? Of course I'll be in during the surgery. I'll be doing the vast majority of the knee replacement. There's one thing that Dr. Greene is better at me at, and that is making sure that your skin looks nice and pretty at the end of the procedure. So she helps me out a lot with making sure that the skin is closed and looks nice and pretty. And I say we have at least a dozen patients a week personally thanking her as they leave after their hip or their knee replacement, which sometimes make for awkward stops and pictures with other patients in the hallways, but overall it's a fairly good time. If you'd like to come and meet the team at Carolina Regional Orthopedics, please give us a call.